Deonandan to start us off. And Raywat, this is Dr. Brent Rusin on COVID in our schools.
20% of overall COVID-19 cases are in school-age children. As of May 6th, there were 574 cases linked to schools in the prior 14 days. And that included 25% increase in staff and a 67% increase in student cases. And like we said, 20% of current COVID-19 cases are in school-age children. We've seen this increased cases in some of those younger cohorts in this third wave, especially compared to the second wave. The number of schools with one or more cases has been increasing. Last week, we had 176 schools. This week, 208 schools with one or more cases.
3/4 of those cases are here in Winnipeg. Those numbers do tell a story. So, Raywat, based on your experience, especially with the B117 variant first found in the UK, are children not only getting it, but bringing it home as well?
Oh, yes, absolutely they are. There's been some strange magical thinking this past year around children being magical unicorns that don't get it or pass it on. Clearly they do. Schools are pandemic accelerators, as many of us believe, though some still don't accept that. B117 being hypertransmissible means that everyone is more likely to get it. And the fact that we've vaccinated most of our older people means that naturally the cases you do see are going to be amongst the younger population. So those two factors are what's driving this observed increase of cases in children.
Why do you think it is that officials for many, many months, and we're, I guess, 15 months into this, have said that transmission really isn't happening in schools? These kids are picking it up, say, at home or at other events.
I think it's a failure of the way the contact tracing is done. I don't mean to blame public health for that, just the way it's done. For example, if an outbreak happens in schools and the kids are all asymptomatic, you won't detect it. If a kid brings it home and gives it to their parent who becomes symptomatic, then an outbreak is determined, contact tracing is done, the child is discovered and assumed to be having been infected by the parent rather than the other way around. So detecting an asymptomatic index case amongst children is difficult and almost impossible given the way things are set up. So I'm not surprised that schools are not identified as accelerators, even though they probably are.
Global's Brittany Greenslade did a story recently with a doctor, and some research was done that adults can spread it to, I believe it was 3 to 4 people very quickly, whereas kids, they suggested, were spreading it at a much smaller rate, and that multiple kids would have to be positive to spread it to an adult. Have you found that to be true? And if so, why would that be the case?
I've not looked at the data that closely, but it doesn't surprise me. Kids have smaller lungs, can eject particles a smaller distance. So the expectation is you don't need the 2-meter distancing for them. However, COVID being airborne, as most of us accept now, if the kids are in enclosed areas, then the people in the room are likely to be infected. The other thing to consider, though, is that this is balancing at the fact that kids tend to have more social contacts per week than adults do. Most of us see 5 or 6 people in a given week. Kids see up to 30 people in a given week. But that seems to be ratcheted back during COVID due to the restrictions. So there are competing factors here at play.
Raywat, how easy is it to catch COVID with the variants out there as compared to Wave 2? Compare Wave 3 to Wave 2.
It's hard to put a number on it. I would say about 30 to 50% more transmissible, if not more. So the masks we use during Wave 2 aren't sufficient now, the 1-layer mask. You need a 3-layer mask or an N95 mask. Also, during this wave, people are indoors seemingly a bit more, and so the aerosol aspects are more at risk, are more a thing. So I can't put a number on it, but if I had to, I would say 30 to 50% more transmissible, therefore that amount more likely to get it. And then you layer on top of that people's seeming laxity when it comes to public health guidance. The fatigue is a real thing. And so it seems that the fear is not there anymore. And so we're taking chances that we should not be taking, more so now than we did in Wave 2.
I'm wondering if the messaging needs to change. And we saw one province come out with sort of a reopening plan, if you will. If we hit this, we'll do this. If we hit that, we'll do that. As you mentioned, the fatigue is real. And we see the social media all of the time, and people complaining, I can't do this anymore. So do we kind of need to hold that carrot and say, listen, if we get this many vaccinations done and we drive the numbers down to here, we can do X?
Yes, I think that's a very good idea. It gives people hope. It gives them something to strive for. Now, it does matter what indicators you are advertising here. On the one hand, we have the indicators like test positivity rate, reproduction number, etc., number of people vaccinated to determine when the disease is waning. But we also need to consider those indicators that determine how resilient we are against future infection. For example, is our public health system capable of doing sufficient testing or contact tracing? That's only possible if certain things come below certain levels. It's one thing to say that our ICU now has capacity. That's easily overrun. The trick is to get us to a position where people aren't getting COVID anymore, and when they do, we can suppress it fast. So selection of the indicators is important. But to answer your question, absolutely. I love this plan of dangling carrots as indicators.
With Raywat Deonandan from the University of Ottawa on 680 CJOB, Richard and Julie with you. This is Global National's Crystal Gamansing on the announcement made in the UK today.
Groups of 6 will be able to sit down indoors for a meal and a drink starting on May 17th. It really is a huge step forward when you consider the fact that England has been in a lockdown since before Christmas, and it was a strict lockdown at the time. Only essential shops were allowed to open. So basically you could only go inside a grocery store or a pharmacy, and even then numbers of customers were limited.
Raywat, what has the UK been able to achieve here to allow this to occur?
They had a real lockdown. They had a nationwide effort under the guidance of the NHS. They had vaccination at incredible scale, using a vaccine that most people agree is good. And they had rapid testing strategically positioned as well. But the two biggest things was vaccinate as quickly as they could and a real lockdown. Now, they suffered for it, no question, but it shows us that's our path forward. We maintain our current restrictions, we drive cases down, we vaccinate on top of that to keep cases down, and guess what? We can do the same thing.
And is that maybe a good example for the naysayers as I look at the red banner across the Global News website that says breaking for the first time in a year, no deaths from COVID-19 in Britain today?
Yes, the naysayers, I can't believe there are any left who think, A, this disease is not serious, and B, this is not the right way to approach it. We have to get the cases down. Look at India. People are still struggling and dying in tragic numbers there. So we don't want to be that. But it looks like across Canada, the numbers are coming down. ICU capacity is a lagging indicator, and that's going to be with us. That problem will be with us for several more weeks, if not months. But it looks like we're doing all the right things. This success is due to the economic restrictions, in my mind. The vaccination is helping, to be sure, but vaccination on top of that is what's going to keep it down. So it's important that we get that message across and that people don't look at the declination of cases as being a reason not to be vaccinated. You must become vaccinated to keep the cases down.
Lots more vaccinations happening in Manitoba today, hearing about a place that has 600 Moderna shots available for people. So as always, we appreciate your time. Raywat Deonandan is with the University of Ottawa. He is